Hello, I'm Dr. Joe DeMarco, chiropractor and owner of OkraMed Health. And what I'd like to do today is follow up a little bit on the video we did yesterday on posture. Now, yesterday I did a quick video on a very easy and effective exercise to help strengthen the muscles between our shoulder blades by using a piece of rubber tubing so that we strengthen the muscles behind our backs to keep the shoulders back. What I want to do today is go over a little bit about how to stretch out some of the tight and tender muscles we develop in our neck area. Now, all day long we're constantly looking down. We're looking at our cell phones. We're looking at our computers at our desk. Sometimes it's off to the left. It's off to the right. We're reading a book. We're constantly forward in this society. And what happens is these muscles get very, very tight. And soon, after a while, our heads actually start coming forward and forward and forward. So what do? We have to stretch these muscles of the neck. Now, oftentimes it's kind of funny. People are always like, oh no, you don't want to stretch your neck out. Why not? The neck is a movable part of the body, and it has 6 normal ranges of motion. It has flexion, extension, lateral flexion to each side, and rotation to each side. So there's 6 normal ranges of motion, just like an elbow has ranges of motion, a knee, a lower back. We stretch those areas all the time, but for some reason everyone feels that you don't stretch the neck. Well, that's not right. You know, if we don't stretch these neck muscles, what happens is over time, your neck gets very tight. If you haven't done any stretching with your neck in a number of years, try to go through some of those normal ranges of motion, and you'll soon realize how tight and stiff your neck is. So what we want to do is every day go through those normal ranges of motion. It's very simple, takes a couple minutes, and I'm going to show you a couple simple little techniques you can use to actually get the most out of your stretching. But first off is just simple ranges of motion. Very safe, they're normal ranges of motion. What I like to do before I stretch any area of the body, I like to get some blood flowing, so you could either apply a little moist heat to the area of the neck if it does feel a little extra tight, or you can take some type of massage ball like a OkraMed Health Tai Chi ball and basically just nice and easy rub it over some of the muscles of the neck and the trapezius muscles just for a minute or two, just to basically stimulate a little blood flow and get some loosening of the tissue in there. And after you do that for just a minute or two, it's always good to warm up muscles before we stretch them. We never want to stretch cold, stiff muscles. After we do that, what we're going to do is just go through each of those 6 ranges of motion and hold them for 30 seconds. So you're going to bring your head all the way down. Shoulders are going to be back. We're going to hold it for 30 seconds. We're going to go back into extension. Now, when you go into extension, one thing that helps is keep your mouth closed. If you keep it open, you actually take some of the stress away from stretching the muscles. So I always try to keep my mouth closed when I stretch extension. So keep your mouth closed and stretch back that way for 30 seconds. 30 seconds to the right side, 30 seconds to the left side. And when we do what we call lateral flexion, look in a mirror for a while at first and make sure you're keeping your chin in a nice lined up with your sternum. We don't want to be doing lateral flexion where your head is in all different crazy positions. Just try to really concentrate on tilting and not rotating the head at all when you do lateral flexion. So we're going to stretch to each side for 30 seconds, and then keeping it once again shoulders back, chest up. We're going to turn to the right side for 30 seconds and to the left side. All comfortable motions. Just take it to the point where you feel some tension in the muscle, and that's it. After we do that and we go through those different 30-second ranges of motion, a little trick to help get a little more out of that is to actually apply a little pressure and actually kind of tie down or press down on some of the muscles. So for example, if I'm going to do extension or rotation or lateral flexion, you're going to notice that as you go up, these muscles actually go up with the motion of the neck. So what I like to do is I'll take my fingertips and I'll get right underneath my clavicle, or what we call our collarbone, and I'll hold those muscles actually down. And now what I'll do is I'll go through those same motions, and this time I probably won't go as far, but I'm going to go into extension. But now I'm holding down those muscles, so I'm going to get actually a greater or deeper stretch through here. And same thing as I go off to the right side, and I go off to the left side, and as I do each motion of rotation, and I'm holding them once again for 30 seconds, by pinning down the muscle tissue here, you're going to get a greater stretch through here. I would do that once, going through all the different motions again for 30 seconds, and I'll do it one final time, and I'll just change my hands maybe an inch out to each side, and I'll actually hold down a little bit wider this time, and once again going through all the ranges of motion. This little technique doesn't help you much for flexion, but on extension and lateral flexion and rotation, you feel a really deep stretch after you do it. Matter of fact, after you run through all these ranges of motion, both without any pressure and by running it through twice with pressure here and pressure a little wider, after you do all that and you move around, you're going to feel a great almost relief in the neck area, and you're gonna notice quite a bit of extra range of motion. And if you do it every day, it's going to feel better every single day. So a couple quick tips. I hope that was helpful. If you want any more information, go to www.okramedhealth.com. If you want us to go over a particular topic, just leave a comment in the comments section, and please subscribe to our Okramed Health channel on YouTube. Have a great day.